Okay, thank you again for joining us tonight. We're looking forward to having a great conversation. We have a lot of really good experts with us. So we are going to talk about career planning in nursing and how to set yourself up for success both while you're in school and for your long-term career. I'm Dr. Karen Ferguson, Provost and VP of Enrollment. I will serve as the moderator tonight. You can also chat in questions as well, and we'll answer all of the questions towards the end of the session. But to get us started with introductions, let's start with Dr. Holliday.
Hey, good evening. My name is Stephanie Holliday, and I'm Dean of Nursing and Health Sciences at Salem. And, I recognize some of these names, so I'm glad you're here. I started my nursing career in women's health, actually, in postpartum and newborn nursery, and then moved to labor and delivery, and from there on to midwifery in graduate school. And so from that point, after graduate school, after a little bit of midwifery, I accepted a position as a lobbyist, a healthcare lobbyist with ASPO Lamaze, which is a childbirth organization. And also then that was a part-time position. Then I went to a full-time position with ACOG and NACOG, which is the Doctors and Nurses Association for OB-GYNs. And in that position, while I was on the Hill lobbying in Senator Inouye's office from Hawaii, I met the Dean of Public Health, the School of Public Health, who recruited me to Hawaii, to the school in their doctoral program. So I went off to Hawaii in their doctorate program. My dissertation research was on the increasing sex ratio in China and Vietnam and Korea. So my data collection took me to those countries. So that was a great experience. And while I was also at school in the doctoral program in Hawaii, I was on faculty in the School of Nursing. So that was my first exposure to education. Formal education was at the University of Hawaii, UH. After completing my doctorate, I came back to the mainland and accepted a position in the School of Nursing at Catholic University. And I graduated from Catholic. My undergraduate degree is from there. So that was coming back home for me. And from there on, I have been in education for 32 years. So I've been with Catholic University, George Mason University, and then I was dean at Trinity University in DC, and now Salem. That's me.
Excellent, thank you. All right, Iris. Oh, Iris is muted.
I was afraid I was going to do that. Good evening. My name is Iris Robertson. I'm the Director of Enrollment. I'm delighted to be here with you this evening and look forward, hopefully, to assisting someone. I've been with Salem University now going on 7 years, and I am very excited and pleased that we've been able to enroll a lot of nursing students over that time.
And Dr. Barnhart.
Hi, everybody. I'm Dr. Ryan Barnhart. I'm the the Dean of General Education and First Year Experience here at Salem. And I've been supporting students, specifically, students in nursing and health sciences for nearly 20 years now. So my job and my specialty is helping students succeed. And that's what I'm here to talk a little about tonight about. I'm very pleased to see everyone, and I'm excited to talk to you this evening.
Excellent. And last but not least, Dr. Odie.
Hello, everyone. I know some of your names from some of my classes. My name is Dr. Michelle Odie. I am an adjunct faculty member here at Salem, and I also am a nurse. I currently am a nurse educator for the neonatal ICU in the Las Vegas area for HCA Health System. I've been a NICU nurse, a pediatric ICU nurse. I've been a flight nurse working specifically for an EMS healthcare system. And then I've also done pediatric and neonatal transport flight nursing also. So I have a wide variety of interesting tales that I can tell you at any time if you'd like.
Great. And I think that dovetails into our first set of questions, which is really in the areas of career planning. So what we heard from you was just such a varied level of experience in nursing, everything from being a flight nurse to being a lobbyist to probably delivering babies and everything in between. So as you look back on your careers, what's the one thing you wish somebody would have shared with you when you were an early or young nurse?
I could address that because nurses have a lot of autonomy, whether you're a beginning level nurse, a new nurse, or an experienced nurse. There's a lot of autonomy involved with those responsibilities and the critical thinking that has to come along with you is incredible. There are times when you're assessing your patients, you're assessing a patient's situation, a patient's family, and it requires critical thinking to make those decisions. And sometimes they're very fast decisions. You have to make them very quickly and sometimes under pressure. So critical thinking was a biggie for me. One.
Okay, Michelle?
I think I can add a little bit to that. When I first started nursing, I wish somebody would have told me that it's okay to be nervous. It's okay not to know all the answers, but it's really important to know where to find those answers. So that's something that I really focus a lot with new nurses when they come into the hospital system is you're not going to know everything, and that's okay. And it's okay to feel a little scared and a fish out of water a little bit, but where do you look to find that information? So knowing that is really going to set you up for success.
Okay, great. And our next question is to Dr. Odie. What career planning advice do you have for early or mid-career nurses?
That's a great question. When you're early in your career, just never stop learning. But honestly, that's something that we can say for all of throughout your entire career. Something that's really interesting in the healthcare system is it's constantly changing. We constantly have new things coming out, new research coming out, and everything that we do in nursing is evidence-based practice. So knowing that it's a lifelong learning journey is really important, and that's really going to help you in your nursing career to know that seeking out that information, being part of those different nursing associations, whatever your specialty is, there is a nursing association associated with it. So if you're critical care, then the AACN is your association, and paying the small amount of due is going to really be beneficial to you because you'll get a journal every month or quarter, depending upon how that association works. And you can really see and be on the forefront of all the information that's coming in. So being a part of those nursing associations is really important because they also have a big part in lobbying, exactly what Dr. Holliday was talking about. So making a big impact on our legislation that goes through. So a lot of that happens at that level. And that's a little way for us to be involved in it also. As you continue on your career path, the sky is the limit in nursing. You can choose anything. If you get to a point where you feel like you don't want to be a NICU nurse anymore or a med-surg nurse, you can always grow and change and take a different specialty. So never be afraid to take on a new challenge.
Okay, and that kind of goes right into our next question, which is that there are so many different types of nursing. So how does someone look into like the difference between becoming a dialysis nurse or a flight nurse? Or, you know, even maybe working, I've seen some nurses that transition out of the clinical setting and get into medical device work and selling the vests and those different things. So how do you explore those different specialties and figure out, you know, what's the right fit for you?
That's another really great question, and it's very specific to each individual item that you even labeled. So specifically, if you're interested in flight nursing, then it's really important to have an ICU background. So at some point in your career, you do want to spend a couple years in intensive care, whether that be in an adult intensive care unit or in a pediatric intensive care unit. Either or would be sufficient for most flight nursing companies. If you're talking about dialysis, again, an ICU setting and having that background is a really great idea also, and will look good on your resume if that's something that you'd like to do, because oftentimes with our dialysis patients, we can have critical issues that you need to be able to manage. If you're talking about travel nursing, which is a hot topic right now, a lot of nurses are looking into traveling because there's some really good assignments and some great money out there right now with our pandemic that's going on. This is very specific to your area of expertise. So if you have a nursing background, and let's say because I'm a NICU nurse, your background is neonatal ICU, then you want to make sure that you have a good knowledge base in that specialization. You don't want to work for only a year in a specialization, then go and try and travel. Okay, because remember, you're going out into these situations where you're not going to have a lot of orientation on the unit that you're going to be on. You're not going to know everybody around you and have a good support system. So you have to be very self-sufficient if you choose to do something like that. Very attainable, but making sure that you have a good knowledge base is really important for that. So there's so many different things that you can get into. And if you ever have any questions, you can always send an email to I or Dr. Holiday, and we can help you with thinking through some of those thought processes for your career.
And can you talk a little bit about the differences in schedule? And then I know there's so many different areas that nurses can go into, but maybe in a few different categories, like the day in the life of, you know, a clinical nurse versus all of the other specialties. You know, what can somebody expect? Can you work 9 to 5 as a nurse, or are you automatically going into shifts?
You can, again, kind of the sky's the limit almost here, but it really depends upon what you choose as your career path. So if you're going to work in a hospital setting, you should probably think that you're going to be doing 12-hour shifts. Typically, all hospital care systems are going to do 12-hour shifts. And as a new nurse or as a new employee to a hospital or unit, you should probably expect to be on night shift, because it is usually a seniority based and it can take a little bit of time to get to a day shift position. So when I talk about night shift and day shift, I'm really talking about 6:30 or 7 a.m. to 6:30 or 7 p.m. Somewhere around there is typically what they do for their shifts, and vice versa for nighttime. If you're somebody that wants a regular schedule, a 9 to 5 position, you can totally have that. But we're talking more about a clinic position. So if you would like to work in a doctor's office or in a cardiac clinic or something like that, where you see patients outpatient wise, surgical care also, if you do an outpatient surgery center, that's a great 9 to 5 position also. There are different thoughts also. So if you are in a Kaiser healthcare system, sometimes they do 8-hour shifts, but typically 12 hours is what we see across the United States for nursing. If you are interested in flight nursing, that typically is a 24-hour shift, almost like a firefighter, where you have a base and a bedroom and you stay there and you're on call for 24 hours. So very different schedules all around, but I think the important thing to understand is there's something for everybody in nursing and something that'll work for your lifestyle. You just have to be able to look for it and be open to the possibilities.
Excellent. Speaking of possibilities, Dr. Holiday, is there a right time for someone who maybe already has their RN to go back to school, and kind of how does the RN, the MSN, and all of the other degrees in nursing fit into a career plan in nursing?
Well, that is a good question, because nursing really isn't a one and done kind of career. It's ever-changing field, ever learning has to go on. Nursing is really a lifelong learning career. Well, and that said, as a new nurse, it really is recommended to gain some experience in that role, where you're comfortable and confident in that role. There's orientation in the beginning that is quite intense, and you want to be safe and you want to feel comfortable in that role. Then once that happens, you want to be looking at advancing your career, going to the next level. And actually that really applies to all levels, whether you're a CNA or a LPN or ADN, BSN, MSN, doctoral level. You're going to want to move, continually learn. Basically, education is your ticket to advancement and new career. So I encourage, as you're in school as well as working in your career, keep an open mind, because as Dr. Odie said, nursing, there are so many possibilities in that career in nursing. So keep an open mind for other specializations, that you may be exposed to. The sky's the limit.
And Dr. Holliday, how do hospitals vary in their requirements? I've read that some hospitals are, at least prior to the pandemic, were really moving towards this magnet status, where they were requiring, I think it was like 85 or 90% of their nursing staff to earn a BSN.
Right.
How has that changed during the pandemic? And is that still something that you see as the career field continues to grow?
I haven't really seen a change in that specifically, because the BSN is really now the preferred degree of majority of hospitals because of magnet status. And for those who don't know what that is, it's the ANCC, the American Nurses Credentialing Center, grants a excellence award to hospitals and healthcare organizations that have demonstrated this high standard and excellence in care, excellence in, it's not just patient care, but it's also staffing and leadership and that sort of thing. So more and more hospitals are going toward that. And I guess besides, besides specializing, if you're going to specialize in a master's degree, certain positions in nursing, they really do require a master's degree in order to specialize. Nurse practitioner, nurse educator, clinical nurse specialist, and psychiatric nurse practitioner, those kinds of things. So that would be why you would want to move to a master's prepared nurse. But again, the ADN really would want to look at moving to that BSN as soon as you're comfortable with that role, because your pay is going to be higher. The job responsibilities they're different. They're enjoyable. It's more of a managing type position.
Okay, great. Thank you. So we're going to transition just a little bit. And we've got some questions for Dr. Barnhart that have come in. So you mentioned working with a lot of students, and specifically a lot of nursing students over the years, and really been focused on student success. So what's the best advice you can share for a nursing student, whether it's a 2-year, 4-year, or a master's nursing student?
That is a great question, and it may be one that you've heard, and if you have, stop me. But if you have, it's probably good advice to take. And that's if you fail to plan, you plan to fail. So essentially, if you don't have a plan for how you're going to accomplish everything, you're setting yourself up for failure right off the bat. And that's something that we want to avoid, especially when it comes to academic success, career success, and then personal growth and success as well. So just becoming better at planning, even if it's just 1%, if we can get 1% better every day, in 10 days, we're 10% better, right? Or at least, I'm not a math major, but I think that's how it works. And so if we can kind of apply those little, that sense of getting better at planning our days out, planning our schoolwork, planning our balance of work, life, and family around our schoolwork, we can get better at just accomplishing our daily tasks and being successful all around.
Okay, great. And there's been a lot in the news lately about burnout in the nursing profession, especially with COVID-19, and a lot of nurses. There still is a pretty big gender difference in nursing, and in either way, nurses tend to find themselves, regardless of gender, in caregiving positions at work and caregiving positions oftentimes at home. So when they get ready to step into school and they're already balancing so much, do you have any strategies for how to, in a very healthy way, continue to fit school and career planning into, I think, what could be an exhausting profession?
Absolutely, and I think that comes with the territory a little bit, right? You want to be a nurse, you're kind of signing up for that a little bit. Maybe that's what excites you into it. Maybe it's the opportunities that it involves. So already understanding that, and understanding that wellness is a big part of success in your life, in school, in your family, in your job. Balancing it all is important. So I think one of the biggest strategies there for students that I have worked with that have become successful is just how they understand and appreciate their time. You have to use it a little bit better. Maybe you have to get up, at the first alarm instead of hitting snooze 5 times, right? Because that, 15 minutes could be the time that you post a discussion today instead of missing discussion this week, right? Or the 15 minutes you spent on TikTok today, maybe that was 15 minutes we could have better spent, reviewing for our anatomy test. Maybe on TikTok too. Shout out to my friends at Institute of Human Anatomy. So there are ways to better use the downtime that our students have that you're probably already wasting already. So if we can get better, again, just at recognizing those things and using them, it really helps us stay mentally well, keep our all-around multidimensional wellness in check, and also lets us enjoy that family time, give us the proper time for schoolwork, and still have some personal time as well.
Okay, and I think kind of inherent in your comments was also maybe recognizing when things are getting out of balance or someone's starting to get behind. So what advice do you have for people when they start to get that overwhelm, or they realize that maybe they're getting a little bit behind in things? What are some tactical strategies that they can use to get caught back up or get things going again?
Absolutely. I think the first thing is to remember that you can always get help, right? It's never the end of the world, literally, and figuratively for that matter. Whether it's resources at Salem, like the Success Lab that's in the Benedum Center, or the online resources from that, or just talking to the Writing Center, or using the tutoring resources, or dropping in to talk to your professor that you missed that discussion post in. Being proactive in that respect is never going to be a bad thing. And I think that you'll find that the individuals, the faculty, the staff, the administrators at Salem University particularly understand that. And I think that, as a student, it's okay to feel overwhelmed sometimes, but always remember that your main priority is to reach out and know that there are people here to help you for that. So I think that's the one piece of advice I have to give there is don't be afraid to reach out. There's always someone to help you.
Yeah, and I would echo that. I think I know a lot of us, and I know I went back to school as an adult, and sometimes it's easier to hide. And that's the last thing that we want students to do. We don't expect students to be perfect. We know everybody's balancing so much, especially right now. So let us know, right? Like raise a hand. And even if you don't know what's wrong or you don't know what you need help with right away, it's better to raise that hand than, you know, to ghost us and hide behind something and be afraid to ask for help, because we've all been through it and not a single one of us here are perfect. And we might want to think we are, but we're not. And everybody gets behind and everybody loses track of timelines. Everybody makes mistakes. And it's all about how you recognize that and get back on track. And I think that's one of the key elements for, you know, all students, and just knowing that, you know, the Dr. Holiday, the Dr. Odie, the Dr. Barnhart, that's an academic accomplishment. It doesn't mean that we don't remember what it was to work 12-hour shifts and go to school and raise kids and do all kinds of stuff. So I just want to echo that. And before I talk too long, we're going to turn it over to Iris. Iris, in your role, you work with a lot of different students who are choosing between different degrees and different programs, both at Salem, and they might be looking at Salem or other institutions. How do you help students find the right program fit or the right program to fit their goals?
That's a great question. First, I'd like to say that admissions, we exist for our students. We are here to help our students, and we want their transition into Salem University to be as smooth as possible. Should you have questions, we're going to ensure that you have received all the necessary information so that you can choose the right program. And if need be, and you have additional programmatic questions, Dr. Holiday is always available to speak with our students, and we would not hesitate to connect you so that we can ensure that moving forward, you are in the right program for you. And we will work tirelessly to make that transition for you seamless as possible, from your enrollment documents to your financial aid to your new student orientation. We are there with you all the way. You are never going to be alone.
Okay, and you also have worked other places other than Salem. And what do you think it is that sets Salem's online BSN and online MSN programs apart from others?
I'd have to say first and foremost, of course, is the fact that our class sizes are small. Your instructors know you. They know you personally. They know you as the individual and the student that you are. You're more than just a number. And that being said, you have that personalized attention that from time to time, of course, you absolutely need. Our classes are 100% online. Our students do something very unique that does set Salem apart. You take one class at a time. Usually the classes are 4 weeks in duration, but some exceptions may apply. But when you think about your work schedule and you're balancing your life, this is doable. And we hear that time and time again with our students. They're excited about our format. Our format is very, very unique, and it really, really works for them.
Excellent. So I'm going to open it up to the floor between all of our panelists. Is there anything that you wanted to say tonight that you haven't yet said or shared?
Oh, I do. I just want to say to all of our students, prospective, current, future, you can always reach out to me, ryan.barnhart@salemu.edu. If you have questions about things in general, even if it's about the general education courses and how they can, pay off for your nursing career. Dr. Odie mentioned about being well-rounded. That's one of those things there too. So anything we can do to help, that open door policy from general ed is open. Happy to assist however I can.
And I wanted to share too, our programs are very affordable. The RN to BSN program is only $325 per credit hour. The MSN program is $395 per credit hour. So that is very, very affordable, very doable.
Excellent. Thank you.
I think I wanted to touch a little bit on a resume, if that would be beneficial to our students online here. A resume is really important when you go to apply for your first nursing position or your 50th nursing position. It's the first impression that you make. And it is correct. Your first impression, you only get one time to make it. So you want to make sure that you have a really nice looking resume or CV, whichever one you would like to call it. One thing, I look at nursing resumes quite often. We have a new grad program in the unit that I educate on. And something that we typically look at are some very specific things. So when you put your information on, you want to present yourself as professional. So a professional email is a good idea. So using your name or something like that is good. Hot shorts 10 is probably not a good idea on a resume. It's a cute email, but not for a professional job. So just having those thought processes when you go to write down your resume is really important. Another thing that's a really good idea is in your different positions that you're putting on your resume, putting a little synopsis of what you were required to do or your job duties is a really nice thing also. So sometimes we'll get nurses that apply for a position. We have a level 4 NICU, which is the highest level, and they'll put that they worked at a facility, and it's nice to know that yes, they were at that same level. So we know when we bring them in for education, we don't need to do a 12-week orientation. They could do a smaller orientation since they're used to the more critical patients. So some of those ideas are really important. Just making sure you look over it. And another thing is have somebody else look over your resume before you submit it. Having another set of eyes is a really good idea.
Okay, well, since you opened that up, what are some interview questions that nurses could expect for their first, second, or maybe even third position?
So another thing that you need to think about is when somebody asks you for a specific instance, then they want you to tell them about the specific instance. So sometimes I'll ask a question, I'll say, name a time that you worked as a team. It doesn't have to be in nursing if this is your first nursing position. You could talk about a team project that you did at school. You could talk about something like that. But what we want to hear is you be really specific and tell us about that actual time when you worked as a team and you had difficulty in that team. Not a lot of times what happens is people start being generalized with their responses in an interview, and it doesn't really give us the picture that we want. So we'd like to see you give us that specific instance. So take time too. When somebody asks you a question in an interview, take a minute and think. It's okay. We expect that. And actually, I like to see that instead of somebody just snapping out an answer right away.
Fantastic. So I'm going to put you guys on the spot for one last set of questions, unless we get any that come in through chat. And that is, as you think about, hiring a nurse or promoting a nurse, we heard critical thinking, we heard teamwork. What are some of the other competencies that you look for when you're trying to hire a nurse?
Prioritization, the ability to take a whole set of responsibilities for a day, quite a number of tasks that you need to get through for the day, to be able to prioritize those so that you can get through the day safely, providing safe quality care for your patients.
Anything else?
Good communication skills, being able to talk well, speak professionally. That's important. Remember, we are the first line always with everything as a nurse. We're by the bedside all the time. I like to say we're more important than the physicians because we catch everything first and then we tell them to come and look at the patient. So being that professional person and being able to communicate is really important. And that also goes into the appearance. So when you show up for an interview, make sure that you look the part, you look professional. Don't show up in ripped jeans and flip-flops. Really present yourself well, like you really do want this position, because that will show a lot. Because we really want people with a passion for nursing and a love for it, because we're taking care of people in their worst times. So we really need to show our passion for what we do.
Passion and enthusiasm.
Yes, absolutely.
All right. Well, I'm going to make one quick connection then, which is that you know, nursing is obviously going to come with some challenges. You're going to have good days and you're going to have bad days. School is going to very much be the same. So when you have those bad days in school and, you know, you just can't get a concept down or you get behind on your assignments, both of those situations are going to rely on very similar skill sets of advocating for yourself, making sure that you know where to go to get help. All of those things that you're going to learn in school that help you pass your classes are going to be the very same underlying skill set that you'll then use in your career to help you get through those challenging days as well. And it does look like we had a question come up in chat. Is it better to have a medical job history on a resume when fresh out of nursing school?
I can take that. If you have a medical background, yes. Typically, I would tell you that if you're an experienced nurse and you're applying for a nursing position, what's on your resume should be everything that pertains to the position. But as a brand new grad, we don't really expect that to be present. If you have it, bonus. If you don't, then putting your other work information is fine also.
Okay, well, thank you very much, everybody. That was all the questions that we had planned tonight. I appreciate everyone coming. Thank you to all the panelists. Thank you to all of you who attended as well. It's nice to see some smiling faces out there. We are always here to help at Salem University, whether it's, if you have a question about whether or not it's the right career field for you, we can get you in touch with someone. Or if you have any other questions about career progression, degree programs, or whether or not continuing your degree at Salem is a good option for you, just let us know. We will be more than happy to connect with you. So thank you so much for attending, and that'll end our session for tonight. See you online.
Thank you.
Thank you.